All right. Hi, everyone. Again, my name is Renee Ebanks, and I am the program manager at the Alex Panton Foundation. And today we're going to be talking about Mental Health 101 in honor of Mental Health Awareness Month. And our presenters today are Dr. Lam and Dr. Stephanie Schirn. I do ask for those who are joining to have yourselves on mute. But if you have any questions throughout the presentation, feel free to put them in the chat, and we are going to have a short Q&A at the end so that we can address whatever concerns you have coming up. Okay, so we're going to begin now. Okay, so for our agenda today, we are going to look at we're first going to introduce our speakers, and then we're going to look at what mental health is, the definition of that, as well as what mental ill health is. Then we're going to look at the biopsychosocial model, which I'll allow one of our presenters to talk a little bit more on that, as well as the contributing factors of mental health and mental ill health. And then we're going to look at some local statistics, looking from a trauma lens, resilience building, coping strategies, and resources available. And then at the end, I'm going to ask for everyone to complete a feedback survey where you get a QR code or a link, and then we're going to have our Q&A. So I am going to pass it on to our speakers for them to give a short introduction of themselves, and then we'll go from there. So Erica, if you want to start first, Dr.
Yeah.
Erica.
Hi, everyone. Thank you for having me. So I am a consulting clinical psychologist. I specialize in complex anxiety difficulties, trauma, and emotional dysregulations. Mainly work with young people from the look after children settings, foster care, and adoption care. So I've been kind of around for quite a while now. This is, I think, my 11th years on island, and obviously work very closely with APF and been kind of working on the local statistic data on mental health. So quite excited to be here today.
Hi everyone, I'm Dr. Stephanie Schirn. I am a counseling psychologist here on Island. I work predominantly with children, young people, or adolescents around various mental health difficulties and challenges. Anxiety and sexual-based trauma are two areas that I have strong interest in, as well as working with neurodivergent individuals in kind of managing anxiety and how they kind of perceive that as well. So yeah, that's about me, and I'm happy to be here and looking forward to talking to you all.
Thank you, ladies, so much. So we're going to go into the content right now.
Right. So I'm going to be starting off the first bit here, which is really defining mental health and mental ill health. Before we really get started, I kind of want to preface by saying mental health in general is something that affects every single one of us, regardless of age, background, or even life experience. It's often misunderstood because it only gets talked about when someone is struggling, but we're looking at what mental health actually means today and what wellness looks like. So going on the what is mental health, the World Health Organization defines mental health as a state of well-being where people can cope with the normal stresses of life, work work productively, and contribute to their community. Mental health is not just about mental illness. It includes our emotional, our psychological, and our social well-being. It influences how we think, how we feel, how we handle stress, how we relate to others, and even how we can make decisions. Just like physical health, mental health is something we all have, and it changes over time. So we're going to go on to the next slide, which talks about mental health as a spectrum. So it's important to understand that mental health exists on this spectrum, and we're not either mentally healthy or mentally unwell. Our mental health can shift depending on experiences, stressors, relationships, our environment, physical health, and the support systems around us. There can be times when we feel really emotionally balanced and quite resilient, And then there can be other times when we feel overwhelmed, anxious, or emotionally exhausted. The fluctuation that we see within our mental health is part of being human. It's not abnormal, and it doesn't mean that there's anything wrong just because we are experiencing that fluctuation. Um, Mental wellness itself is an active process. It's an internal resource that helps us think, feel, connect, and function. It's not something we achieve once and then never think about it again. It requires ongoing care, ongoing attention, very much like physical wellness, just like how our bodies change over time and we need to adapt how we take care of them. It's the same thing with our minds and our mental health. It can change over time based on the experiences that we're having. Mental wellness helps us to connect with others, regulate emotions, and then solve problems and recover from challenges. It can also help us build resilience, which is an important part of kind of overcoming difficult times in life. Next slide for me, please. So we're going to talk a little bit today. This is going to be both myself and Dr. Lam looking at contributing factors to mental health and what affects our mental health. And I will be looking at the comparison between mental health wellness and mental ill health. We can go to the next slide, please. So down the left column, you'll see benefits of mental wellness, and then on the right, we'll see common signs of mental ill health. When we prioritize mental wellness, it positively affects many areas in our life. It helps us to build healthier relationships and make thoughtful decisions. We're able to cope with stress better. We're able to have a more positive outlook and develop kind of that emotional resilience that's needed. And we can also have a meaningful contribution to our family, our friends, and our community as well. It's important to remember that experiencing mental ill health does not mean that someone has failed at wellness. A person can have good coping skills, and still experience periods of anxiety, depression, burnout, or emotional distress. Um, Likewise, someone managing a mental health condition can still experience moments of wellness and joy and purpose. Mental health is not all or nothing. Mental ill health is kind of a broad term that we look at to describe a range of mental health challenges or disorders. It affects a person's thoughts, emotions, behaviors, and daily functioning. According to Mind UK, 1 in 4 people will experience mental health difficulties in any given year. So this statistic just reminds us of how common these experiences are, and that mental health struggles can affect anyone. And so everyone deserves the same compassion and support as if someone had a physical health concern one year. Um, Mental health challenges can look different from person to person, but then we have our list of common warning signs, which are on the side there. But the most important thing is recognizing these signs early and kind of accessing support sooner rather than later, even if it's just checking in with somebody, that can have a meaningful impact.
And now Dr. Lam is going to go into the biopsychosocial model of mental health.
Okay, so thank you, Dr. Stephanie, for explaining the differences. And yeah, so I'm going into kind of into a little bit more of the biosocial model. This is a model that quite commonly used in the clinical world, or in a way of understanding what kind of gone wrong to understand how mental health illness kind of maintained, or how do we improve, right? So the World Health Organization also really recommend a holistic approach in understanding biological, psychological, and social factor. How do those three factors interact together that either maintain or cause or lead to or contribute to our mental health difficulties? So let's have a look at each of those area. So the biological factor is the brain and the body. So biologically, we can kind of look at that. Actually, over 1 billion of people globally actually experience a mental health condition. That's quite a lot, right? And biologically, we know that neurodevelopment, which is the way that your brain is constructed, is very much shaped by your early experiences as well as by your early experience of stress and adversity, which we will look at quite a bit more later, what adversity means and what does it do to our brain and things like that. Also, our brain is very, very easily influenced by stress, especially prolonged chronic stress would actually change the way that the brain develops and the way that we respond in our central nervous system, which we will look at in a little bit. The psychological factor looks at the mind and the emotions. And just from a statistical perspective, depression affects about 5% of the adults in the world. Anxiety disorder affects about 4.4% globally. And interestingly, since COVID, we have a 25% increase of anxiety and depression disorder, which I don't think is kind of surprising, isn't it? That when there is a huge epidemic, then it does affect our mental health and our well-being. Socially, we look at the environment and we look at the context of what of the person kind of grow up. We know that violence, neglect, poverty, inequality is a major risk factor that affects the person's safety, affects the way that they relate to the environment. We know that children and adolescents are particularly sensitive to social stressor because the brain is still developing, right? They're not so kind of robust. So it's very important us as clinicians, when we work with someone, we also understand their context, their environments, the school they go to, the environment they grow up in, their home life, and all of those things. We know that statistically speaking, there is quite big discrepancy between the quality and the quantity of treatment that people who are on the lower income sector or on the middle class kind of sector they receive. There's a big discrepancy, and I wonder whether that is to do with kind of our health insurance structure. Now, how this domain, the biology, the psychology, and the social domain kind of interact is that we know that social adversity very often will lead to a change in our biological system, right? So if there is a stress factor in our environment, our body respond to it. We have a, stress response. We respond in a way that help to protect us, help to keep us alive. And psychologically, we will find ways to cope so that it either build our resiliency, which is kind of what we want, right? Stress actually build resiliency, help us to be stronger, help us to find ways to cope with it. And sometimes it actually, if we stay in that stress factor for a long period of time, it lead to a more kind of risk factor and sometimes lead to kind of mental health. So what we're saying is that the outcome of one person's mental health is not just a single factor, usually is about the interactions of multiple factors. So we're going to move on and look at the local statistic, what our young people in the Cayman Islands kind of been telling us about their mental health. So I can see that this is a graph, and so this in the Cayman Islands, we have about 16.5% of our young people say that they have received the diagnosis of mental health disorder. That is about 337 students. There's a double amount of girls than boys saying that they received the diagnosis, which is quite interesting. And as you can see, there is a trend in the graph since 2018 to 2024. And I wonder whether it's because, accessing mental health services is more available for us on island now, so that we are more able to identify mental health difficulties earlier and sooner. Next slide. This is the statistic showing how our young people seek help. So in 2022, there's 85% of the young people actually want to seek help. And there's a slight kind of reduction in 2024, which is kind of quite interesting because that's the statistic collected after COVID. So I wonder whether the pandemic has actually had an influence in the way that we acknowledge our mental health and at what point we ask for help. Next slide. And this graph actually show how our young people seek help. So the highest number of services that our young people go and ask for help to support their mental health is counseling service, family doctors, or religious institutes. That's quite interesting, right? This means that family doctors, church members, or the pastoral services or nutritionists will need a bit more support in identifying mental health and directing our young people to the right services so they can get more treatment, because they're usually the one who kind of, get the first set of information. Now, the next graph here show the barrier in seeking help, and I think this is quite a encouraging slide to look at, comparing the barrier from 2020 to 2024. As you can see, there's quite a lot of reduction in majority of the areas. The most obvious one is that I am embarrassed to accept support. It has gone from 9.7% to 2%. So this is very encouraging because it means that our society in the Cayman Islands is more acceptance and have less stigma when people are seeking help about their mental health. The next one I find quite interesting is that I feel disappointed with services has gone down from 3.5% to 0.5%. That means mental health worker, clinician has been working really, really hard to help our young people to feel comfortable, to be providing evidence-based services, and to really address the concern that they present with. That is why they feel more satisfaction from the services. It's also very nice to see that the biggest barrier of long waiting lists has gone from 1.3% to about 0.2%. So these are very encouraging data from our young people. The next one, we're going to be looking at some very specific data from a mental health perspective. So the most commonly diagnosed mental health difficulties are depression and anxiety. So we particularly ask our young people to fill out a short questionnaire to see what kind of diagnosis there might be. So the graphs here show that there is a percentage of young people who score in the clinical range. Clinical range means that your experience of the symptoms is severe enough that warrant a diagnosis and a treatment plan. So that's what clinical range is. So in 2024, quite surprisingly, no student would meet the diagnosis of social anxiety. And that's quite interesting. I think that's the statistic collected after COVID. Also, well, it's good news because social anxiety usually means that you withdraw and isolate and feel lonely. So it's good that we don't have that diagnosis, but it's also interesting that maybe after the pandemic, students are more likely to want to have social connection, and that the experience of social anxiety might have kind of reduced because of the need to engage and connect with people. The highest diagnosis was still generalized anxiety, where they're worrying, ruminating about their worries. And then is panic disorder, separation anxiety, and then depression, OCD, and social phobia. And those are the diagnoses that our young people might receive in 2024. Next slide. So we're going to look at kind of the mental health from a trauma lens. So we're going to, well, I'm sure you could kind of be interested. It's like, what is trauma? We talk about that quite a lot. It's like, what is adversity? So basically, adversity or trauma is adversity for once is stress or toxicity or difficulties or things that are like deviate from kind of the norms, and they have a direct impact on our mental health. So what trauma is toxicity or things or events that are so threatening that activate your survival defense mechanism. That's what stress is. That's what trauma is. So trauma can be exposure to events that are stressful, frightening, or distressing. It has a negative effect on our functioning, mental health, physical health, social and emotional health, as well as our spiritual well-being. So the diagram here shows you the type of trauma that we can experience from childhood or through our adulthood as well. The next graph is quite interesting. It shows that the toxic stress from adversity can change our brain development and affect how our body responds to stress. According to the Center of Disease Control and Prevention, at least 5 of the top leading cause of death is actually associated with childhood adversity. The higher number of childhood adversity, the higher the risk. So what that means is having any kind of, adversity as you're growing up actually associate with the increase of risk, an increase of risk to your mental health. And one of the kind of quite significant finding is that the number of adversity in childhood actually associated with the risk factor of suicide as well. And the odds of even attempting suicide is 30 times higher for adults with 4 or more adversity experience in childhood in comparison to adults who have not had any adversity. And that's what the Center of Disease Control and Prevention, which is the global data, have told us. So the next question is like, okay, how about our young people in the Cayman Islands? What are we saying about our adversity experience in our childhood? In the Cayman Islands, there's more than 1 in 4.3 students said that they have experienced more than 4 adversity. That's 23%. That's 446 students have experienced more than 4 adversity in their childhood. And 10% of our young people said that they have experienced more than 3 adversity. That's 197 students. So we got quite a large number of young people who actually in a higher risk of experiencing mental health difficulties, psychological distress. And I think that is why, we do have quite a lot of trauma specialists on island for that reason as well. Now, the next graph shows that the type of trauma reported by our young people, the highest being, is quite sad to say, the highest reported adversity being household challenges. So over 1,000 students said that they actually, where the trauma came from is actually from their own home, where they've been exposed to substance, mental health difficulties of their parents, divorce, separation, or seeing their parents in incarceration or witnessing domestic violence. There's also quite high exposure into emotional, physical, and sexual abuse, as indicated in the graph. And very sad to say that 1/3 of our young people said that they feel they have been neglected either emotionally or physically by their own caregiver or parents. So the next slide, please. How does chronic stress kind of rewire our body and our brain, and why is that kind of quite a important thing to understand when we look at our mental health? what happens is that when there is a huge amount of stress, there's huge amount of scare, huge amount of threats, our body will activate cortisol to protect us. It sends our body into fight, flight, or freeze mode as a way to protect us. The higher the cortisol and the longer the cortisol stay in our brain, the higher risk it poses to our mental health. Why would that be? Is because those are toxicity to our brain, basically. It affects the structure of our brain development. Our brain needs food, needs connection, needs nurturing, needs stimulation to grow, right? So if that is disrupted, as in we're not getting this, the nurturing, the connection, and all of those nice things to help our body to grow. In fact, we're getting loads of cortisol. We're spending a majority of our energy in the lower part of our brain to survive. We're not going to have that much of energy to grow the top parts of our brain, which is our emotional regulation, our executive functioning, our cortex, our higher brain function. So therefore, we're constantly in this surviving mode. We're constantly in this mode of having to either protect ourselves or fight, or we just freeze because it's just too much stress. We're shutting down, we're disassociating, the system just cannot manage. So therefore, it creates this difficulty of learning how to regulate our emotion, how to stay calm, how to stay alert, or how to protect ourselves and how to receive nurture. What then happens is that it really affects the next part of our brain, which is the limbic system, the mid part of our brain. It sends the signal that relationship is not safe and that maybe certain people are not trustworthy. And it really affects the way we relate to ourselves and the way we relate to others. It affects it causes mistrust. We don't feel worthy of care. We don't feel that we are safe in the environment we're in, or we're not safe around the people we are at. And as a young person, the brain is still growing, and having those early experiences for a long period of time really disrupt the sense of safety. Without sense of safety, it's really, really hard to then move on to the next part of our brain to develop problem-solving skill, to have our executive functioning, to be reasonably deductive from problems, or learn how to do complicated math problems and things like that. So that is why the experience of trauma or the experience of adversity is not something to kind of underestimate. We really want to reduce that. And if it unfortunately happens, then we want to be able to heal from that. As you can imagine, all of this brain development and effect of our attachment style, effect on our limbic system, cortex system, it will increase our risk of having anxiety, depression, and post-traumatic stress disorder. Like I said, it affects not only our emotion, it will also affect our behavior. Because if we are not trusting others, we don't feel safe, and we don't have the skill to shift our emotion, it will show up in our behavior in either fighting, externalizing those behavior, or we are withdrawing from others because we're not trusting. So therefore, leaving very, very, very little energy to develop our executive functioning, where our attention, learning, and impulse control are mainly developed. Next slide. And how trauma show up, and how do we kind of heal from that. This is a slide that kind of show you a little bit more about kind of the development, the trajectory. So as a young person, how trauma show up is affect their sleep. It affects the way they receive nurture, which is like feeding or receiving hugs, and it usually show up in their behavior in make them come across as younger because they have less energy in their brain to do the mature stuff, right? They regress into more surviving kind of mode. In school age young people, how that show up is affect their attention, affect their learning. They struggle to keep themselves emotionally regulated. They're more likely to have outbursts. They're more likely to have, mood dysregulation, and they're more likely to withdraw from people because they don't feel safe, right? As adolescent, what is going to happen is that they have this activation of wanting to run away, doing more risk-taking behavior, have mood difficulties, and withdrawal. And a lot of the time, this is the time where the prevalence of mental health difficulties come in as well. So therefore, you have the combined kind of factors of having more higher kind of risk as well. So the trauma practice is that instead of asking what is wrong with you, how much symptoms you have, and giving you a diagnosis, we shift from that to what had happened to you. We try to understand that the behavior is a survival mechanism, is adapted to protect the person, not to be oppositional, not to be defiant. They have simply learned this behavior in order to survive. So it's not like what's wrong with you, right? Not that kind of just behavioral correction. We really want to understand and be curious of why your brain do that. Why does your behavior come across like this? So the healing takes place through safety and relationship connection. And we also believe that responses, make sense in the context of the experience. And in order to kind of train that to heal the brain, we believe that recovery is possible because your brain is neuroplasticity. It means that it has ability to change, it has ability to adapt, it has ability to kind of rewire because the network that you use will become stronger. The network that you don't use will fade away. That's neuroplasticity. We believe that consistent, safe relationship is the foundation of recovery, and trauma-informed therapy will really support the nervous system to learn to regulate in a way that actually makes sense to the here and now. And I'm going to pass this to Dr. Stephanie to talk about building resiliency.
Thank you. Thank you so much, Dr. Lam. So I'm gonna we've learned a lot about mental health and how experiences of adversity can impact us within our mental health. And so what we're gonna do is we're gonna focus on that kind of building resilience and what that looks like for us and ways that we can manage. So if we go to the next slide for me, please. So outside of kind of all of this, life is always going to bring stress. There's always going to be setbacks and challenges. I always say to people who come to therapy, I say, I can't tell you that nothing bad will ever happen again. But what we can do is figure out how we cope and manage when bad things do happen. So resilience is not about pretending that everything is fine or never struggling. It's about adapting, recovering, and then continuing forward despite adversity. The American Psychological Association describes resilience as adapting well in the face of significant stress or trauma. Um, and more importantly, resilience being learned and strengthened over time. It's more than just bouncing back, it's about personal growth as well. And then building resilience takes time. It's not something that just happens for us. It's a lot of kind of tool gathering and preparing and then building from there. Next slide, please. So some of the practical ways that we can strengthen our resilience can be found in kind of within this of these five key areas. So the first one being building supportive relationships. It's one of the most powerful protective factors for mental health, as well as fostering wellness is number two, which is practicing mindfulness, taking care of our physical health, and kind of avoiding any negative outlets. So smoking, drinking alcohol or binge drinking, any substances that we might use, which we say, oh, because it calms me down, it's a release. Those are actually considered negative outlets through the way that they also interact with the body and have a negative impact internally within the body. We find purpose. Our purpose can be through helping others. It can be proactive, moving towards goals. All of those kind of things help support resilience, as well as embracing healthy thoughts, which is accepting change, acknowledging, learning from the past, and kind of developing and healthy thinking patterns. Um, and then one of the strongest signs of resilience is knowing when to ask for help. Um, I like to think that if there was a 400-pound boulder blocking your door in your house, I like to think you wouldn't try to roll the 400-pound boulder by yourself. You might call people to help you. It's the same with your mental health when you're feeling a heavy burden or you're feeling like you need that support, being able to reach out to others, whether that's um, professional support or support within your own network that you already have. Next slide. So this slide highlights the 5 pillars of resilience. Um, these pillars kind of remind us that resilience is multidimensional. It involves your emotional well-being, physical care, social support, purpose, and healthy coping strategies. When one area feels weaker, we can always strengthen another area to help us kind of regain that balance. So I'm going to kind of briefly go through each pillar. So the first pillar is this energy pillar. It's about sustaining and renewing physical energy. So it's taking care of your physical health, setting a strong foundation for resilience by taking care of your physical health. Energy management strategies like regular movement, adequate sleep, nutrition, mindfulness, they're all really helpful strategies that you can combine to help manage stressors and maintain a quality of life. Pillar 2 is future focused. It's all about who you are, where you want to go, and how you want to get there. Um, it gives us a sense of purpose. It gives us a sense of direction. It can help us to navigate stressful situations with less anxiety and uncertainty about the future. So if you feel kind of stuck, and you can't see a way out, having future focus can help you find a new direction to get out of whatever you may be in. Pillar 3 is that inner drive. Sometimes, even when we're clear about what we want, we might not believe we can get there. So it's that self-belief, that drive and motivation for change. It's much easier to kind of find that balance of stress levels when we feel confident in ourselves and our own abilities. Flexible thinking is our fourth pillar, which is the idea of when we're in problem mode, we tend to see things very black and white. And flexible thinking is helping us with the idea of thinking outside of the box, being able to step away from the experience that we're having and come up with new ideas and new possibilities to kind of support ourselves. Um, it's crucial in navigating ongoing change and finding kind of innovative solutions to the problems that we have. And then the final pillar is this idea of strong relationships. So, a common misconception is that resilient people are fiercely independent, but that's not the case. Resilient people have positive relationships and really good support networks. That can be through friends, that can be through family, and through colleagues, through the community. It doesn't have to be from one area. They're people who kind of focus on fostering strong relationships can be acutely aware of how others feel and about challenges in life, and they kind of fully grasp the importance of healthy relationships. And that's something that I think everyone needs to work on fostering. It's not about overdoing it. And now I have to go out all the time and be out and do things, but it's knowing where your limit is and where your boundaries are in kind of maintaining these strong relationships. Next slide. So we're going to look very briefly at just kind of helpful tools around coping. And so we're going to look at those ways to cope, not just on resilience, but in general. So coping skills are tools that help us to manage overwhelming emotions and stressful situations. Different coping strategies work for different people, and part of the process is discovering what's helpful for you personally to make you feel grounded and supported. Sometimes when we feel overwhelmed, or our instinct might be to just shut down or to isolate ourselves. That feeling, very similar to kind of what Dr. Lam was talking about with that fight, flight, freeze, that feeling of actually just wanting to crawl into bed and isolate and pull our sheets over our head and never come out. Um, Healthy coping involves doing the opposite. It involves doing small, intentional actions that can help us to reconnect with both ourselves and others. Next slide, please. So this kind of shows quite nicely that we can have two different types of coping skills. We can have that emotion-focused coping skill and then problem-focused. So the emotion focused is all about calming the mind. It's about doing grounding techniques like meditation, using the 3-3 rule, or like naming three things you can see, three sounds you hear, and moving three body parts. It can be deep breathing, which I like to do squared or box breathing, which is that kind of intake of four, hold for four, outtake or exhale for four, and then hold for four again, and following that pattern. Um, Journaling, taking a bath, taking care of yourself, doing things to emotionally feel more present. Exercises there, and I've actually talked a lot about going for walks or movement. And what I want to really preface by saying is when we talk about exercise, we don't mean that you need to get up and go run a marathon next week. What it means is thinking of what is best for your body to maintain movement, because the physical movement is going to help with our own mental health, because that link between physical health and mental health are together. So it's doing what you can. If that's walking to the end of your driveway and back, that's fine. If it's going and running a marathon, that's fine. It's whatever you need to cope within each moment, but then also recognizing and being aware of the purpose of the movement that you're doing. The idea is this problem-focused coping skills. So it's looking at managing our own time, breaking things down effectively, into smaller goals, listing pros and cons, setting clear boundaries, for yourself as well as for others. And then the most important thing is asking for help, knowing when you need to ask for help. Next slide, please. So in terms of coping, we often say we need to listen to our body. So this idea of where do I feel stress in my body? What do I do when I feel stressed? What are bad habits I engage in? The best way for change is to invoke awareness. The more we are aware of how our body and how our mind deals with stress, the more we are then able to put in changes, because we can go, oh yeah, when I'm stressed, I feel this way, or I do this when I'm stressed, and that's maybe not the best. It's about developing awareness in kind of all areas of life and moving purposefully in how we kind of manage the stress. So taking time to pause and reflect how the stress is affecting us can be really helpful, and it's really intentional as well. Self-awareness is really that most important piece there. Next slide. Taking care of your body, going back to that physical health is really important. Drinking water, staying hydrated, fueling our body, moving our body, doing all those things through the physical health does have a positive impact on mental health as well. Yep. And the last one that I've got here is this self-soothing kind of activities. So going back to this idea of bringing awareness, through bringing awareness, we're using our senses, we're becoming aware of our surroundings, what's going on, and our senses also help to ground us. So these are really helpful ways to kind of think about how we are present in each moment, holding something comforting, smelling something soothing, like having a nice lavender bath, if that's the kind of thing you like. Um, Visual, looking at things that bring you joy, even just things that are very mindful and lots of movements on screen, anything that's going to help you. Listening to things that relax you. I'm a sucker for a Harry Potter audiobook. That's what I like to listen to, and that relaxes because I like Stephen Fry's voice. And then taste, eating or drinking something that brings you joy, tea, sweet treats, anything like that. Next slide. This grounding technique is sometimes one of the most helpful grounding techniques you can do when you feel overwhelmed in the moment. Um, Again, using our senses, five things you can see, four things you can touch, three things you can hear, two things you can smell, and one thing you can taste. but actually it's not just getting it over with, right? The five things you can see, it's not going, oh, cup, computer, bag, done. It's about really focusing on noticing things that you haven't seen before, that you haven't noticed before, looking at that mark on the wall and think, oh, I never noticed that I had that, looking at how the ceiling is speckled and what that looks like, and kind of bringing our full focus into those moments. This is the same with touch. It's not just touching the things in front of you. It's about thinking of when we touch it, what does that feel like? Um, is that quite a soft sensation? Is it a hard sensation? Is it cold? Is it warm? It's thinking all these kind of things. And then that goes throughout all of this, things that are unusual to hear, things you can smell that you didn't notice before. It's about bringing that awareness and finding things that you didn't notice originally. Next slide, please. And then the last one I've got is, which I think a lot of people forget to do, is structure and predictability, making realistic plans and goals for each day, taking one day at a time. You don't need to plan your next 6 weeks, but just knowing that you've set a small goal for yourself, even if that goal is to put your shoes on that day or to go to the supermarket that day or whatever is needed in that moment. I say to people all the time, I get, especially within the financial industry, people coming with lists, very, very, very long lists, to-do lists, and feeling very overwhelmed by how much they have to do. And I encourage them to break it down into what are the things that must be done today because you have a deadline and they have to be done. And what are the things that need to be done, but we can kind of leave those if they don't get finished today. And then every day readjusting those two lists together. Because just because you have something on your list that needs to be done doesn't mean it has to be handed in today. um, Carrying out plans, keeping a sense of control, and feeling accomplished when you've done something can be really, really helpful. It increases predictability, even though our environment around us may be stressful, by using small routines. Um, like waking up at a consistent time or taking a short walk, we're going to support our mental well-being doing that. Um, so there's lots of different things that you can tap into, but I think the big takeaway is being intentional and being aware with what you are doing. Yeah, I'm gonna let it go on to this slide now, and I think Renee, you're taking over there.
Yes, thank you so much. Thank you so much, Dr. Lam and Dr. Schirn, for your, the information, the content that you both have provided has been very helpful and very eye-opening for sure. So now, a big factor, or one of the most helpful factors or most helpful strategies, is looking for support, right? So now we're going to look at professional help and then other resources that are available on island. So my computer wants to behave. Okay, so in case of emergent help, any form of self-harm or suicidal gestures should be treated seriously and urgently. So the two places that you can go when those things do come up: one, the emergency room at HSA, because that is 24/7, right? And then Alex's place, which is catered for 10 to 20-year-olds, that is a facility, the department that deals with mental health, especially for that age range. We're going to talk a little bit more about that. So treatment for suicidal ideation varies based on the level of dangerousness and safety threat. Something that I used to say when I used to work as a counselor as well, and if parents have any questions or concerns about these things, is not it's not necessarily your job to do a full-on assessment of them. If you know that this is happening, go get the support that you need, right? So treatment options include following up with a mental health professional, referral to talking therapy, medication management, as well as inpatient hospitalization. This ensures the safety of the person at risk in a contained environment. So talking about Alex's place at HSA, this is where the GP office or the GP department used to be, in the front there at HSA. So this is a mental health triage evaluation of persons ages 10 to 20. And one reason why we said emergency room earlier on is because Alex's place is open from Mondays to Fridays from 10 a.m. to 6 p.m., right? Whereas emergency room is 24/7. So as I said earlier, this is located in the front of the Georgetown Hospital, which is where the general practitioner offices used to be, and available for walk-in appointments, um, is welcomed at Alex's place as well. So when it comes to additional support, right, not emergent help, but you understand that this person still does need the support. So other resources available on island include our local emotional support helplines, which includes the kids helpline. And this is for kids on 17 under, we say about from 5 years old to 17 years old, but we don't turn anyone away if they access the services. We just make sure that we provide appropriate resources and we actually provide that emotional support for them as well. And for adults, K-Mine, as I said, is the adult mental health helpline on island, and the information for contacting either of these helplines is here on the screen. So for the kids helpline, it's open from Thursday to Sundays from 3 p.m. to 9 p.m. And one cool thing about the kids helpline is not just a phone line, it's also a text line. So if anyone wanted to access the services through text, you can go to the website that's available right there, kidshelpline.ky. K-Mine is just a phone line, which is absolutely fine, but that's also a toll-free number, so that is available to anyone. So credit is not necessarily an issue for someone who needs that emotional support. And they are from Mondays to Fridays from 6 to 11 p.m. And when it comes to the community support spaces offered by the Alex Panton Foundation, we have Teen Talk, which is for ages 13 to 17 years old, monthly sessions hosted on Zoom the last Monday of each month at 4:30 p.m., as well as Breaking Barriers, that is for ages 18 to 30. And this is a monthly session, again, on Zoom, offered on the third Tuesday of each month at 6:30 p.m. So outside of the services that we just talked about, there are many resources in Cayman, and that resource page or those resources can be found on the Alex Panton Foundation website, which you can scan right there and it'll take you to a resource page. And this includes a list of public service providers, a list of private service providers, as well as some helpful resources and info pamphlets and international resources as well. And we are now coming to our Q&A. I'm checking on time. Yes, so we have about 7 minutes for Q&A. And before we get into the Q&A, I am asking for those to scan this code for feedback on this Lunch and Learn. Your feedback is so important because it allows us to revisit what we've done and create more aligned presentations or on topics that you are interested in. So please scan the QR code or you can see the link there. I can share the link in the presentation or in the chat. But if you have any Q&As or any questions, please either unmute yourself so we can have that engaging conversation, or you can put it in the chat. Anyone has any questions or anything that they have for our presenters? Okay, no questions. Okay, so thank you, Emily. No questions. This is very thorough. Um, so someone asks, how in tune is the HSA emergency room to mental health? And so that is for any of you to answer, Dr. Schirn or Dr. Lam. And then Dr. Schirn, you have a question. Do you offer lunch and learn sessions on neurodiversity?
Well, I can start with I'll start with the do I offer lunch and learn sessions on neurodiversity? I don't currently at present. That's not something that I've done before within the community. doesn't mean I'm not open to the idea. But the answer currently is no. I have not done so. How in tune is the HSA emergency room to mental health?
I
I don't know if
wonder.
you want to answer that one.
Yeah, I wonder if the question is, if someone present themselves to A&E, with maybe combination of like physical emergency as well as mental health emergency, how that is triaged and how is that prioritized. Maybe that is how I understood the questions. So just a bit of practicality to answer that question is that obviously with any kind of emergency situation, even if someone is presented with a suicidal ideation or extreme emotional distress or in kind of extreme kind of yes, distress situation, we do want to know that physically they're okay, right? Like as in their body is okay, physically they're well, their blood pressure, if there is a kind of like element that we need to take care of. So how the A&E and my understanding in Georgetown Hospital work is that when someone present themselves, they triage, normally. And if they present themselves with kind of emotional distress or suicidal ideations or anything to do with mental health difficulties, an on-call psychiatrist, an on-call consultant, actually, sorry, pardon me, on consultant psychiatrist who basically is a professional that specializes in psychiatric and mental health difficulties will get called and come to do the assessment in A&E. So that is my understanding. But the triage nurse in any A&E setting will have to ensure the physical safety of the person first. And to be honest with you, yeah, thank you for that. That was yeah, that was. I thought I understood it. So they can take it. Yeah, I mean they are A&E, right? They do they are intended to handle crisis. They are, and I have to say though, I think I know kind of what you're trying to kind of get reassurance about is, hey, A&E is usually filled with people with like, I don't know, road traffic accident or blood or being really sick, and listen, it's not the ideal place for someone who present with emotional difficulties to kind of go to. And I think that is why, with a especially with a young person, we do encourage them to go to Alex's Place because Alex's Place is actually gear for mental health and emotional difficulties. And they are they're actually run by children adolescents psychiatrists, community mental health nurse, and children adolescents specialist psychologists. So Alex's Place is absolutely more geared for that because they run by mental health professional. A&E crisis management, they make sure your physical health is okay. Psychiatrists will get called and then it will get triage. So that I don't know whether that is helpful.
He said, thank you, Arthur, for your question. He did say, just based on an experience, I wonder what you can say to ensure that they take it as a crisis. I guess he's looking at the
Yeah.
language,
Yeah. I think what you're saying is that, like, what will activate that protocol to call a psychiatrist, right? They have their own kind of triage question. And to my understanding is that, medical professionals don't kind of dismiss kind of mental health crisis or emotional distress. And I know that they do have a threshold that they need to meet in order to call the on-call psychiatrist. But we have patient rights. When we utilize a service, we can advocate. If you feel that a psychiatrist is needed, you can advocate for yourself, advocate for your children that you require, a consultation with a psychiatrist. And based on emergency, they will either call the on-call psychiatrist, I would imagine, or they offer, outpatient um, mental health consultation. That's my understanding.
Yeah. And just to piggyback off of that as well, Dr. Lam, is I think the intention with A&E is to get the initial first support to potentially balance and provide whatever out of the emotional distress. And then A&E are naturally going to refer you on to other places. So it's just like if you went in with a broken leg, they're going to eventually transfer you to the specialist for that broken leg, not keep you within that A&E spectrum, but they're going to help you with pain relief or anything along those lines physically. It's very similar with A&E, whether it's helping that emotional distress in the moment to then get you to a place where they can then refer on if it becomes an outpatient situation, and hopefully provide you with advice on where to get support psychiatrically and psychologically as well.
Absolutely. Mhm. That's a nice way to kind of conceptualize it. It's like it's an emergency place. It's not there to kind of they manage it, and then whatever you need after will get triage, right? Yeah. Yeah. It really is for crisis management when your kind of safety and life is at risk, right? Absolutely.
Yeah, so looking at the time, it is 2:01. I just want to be mindful of everyone's time. But if you have any more questions, please scan the QR code and complete the feedback, and you can leave your name and your email within that survey, and I can get back to you with any questions you have because there's an option to ask additional questions. So feel free to complete that. And we just want to say thank you so much to our presenters. You both have been amazing and very informative, and we look to partnering more in the future. So thank you so much.
Okay. Thank
There,
you so much. It's a great turnout. Like I'm actually quite overwhelmed with how many people sacrifice their lunchtime to hear us talk about mental health. And things like that always encourage me to do more of this kind of work, isn't it? Yeah.
of course. Thank you so much. All right. Have a good day, everyone, and please take care. Bye.
Bye-bye.